Hello, welcome to any community. In today's video, we are going to discuss one of the important model of the approach to Sapeksha Nidana. What is being termed as hypothetico-deductive model. In the beginning, we have discussed two videos of Sapeksha Nidana and Vyavacchedaka Nidana. This video will be giving you an approach how to do the Sapeksha Nidana and Vyavacchedaka Nidana. This is the several models are being practiced in determining the Sapeksha Nidana and Vyavacchedaka Nidana. This is one of the earliest model, one of the most frequently used model. That is what we can say hypothetico-deductive model. When you think about the hypothesis or the deductive model, it is actually comprising two variables or two terms, hypothesis and deduction. What is the word meaning of hypothesis? It's a clearly testable statement predicting the relation between the variables or outcome of a study. So we are going to discuss about, suppose if the person is presented with cough, it's one type of variable. Other variable will be the person may suffer from either respiratory disease or cardiac disease. To a lesser extent, the person may have alimentary canal disease, wherein the food that is coming from the stomach into the lungs or respiratory passage in the form of aspiration. This is comparatively less frequent. One variable is cough, the other variables are three different diseases as such. So that is what is considered to be the cause and effect. This is how, if the hypothesis, we can able to make the statements between the two variables. Deduction in the sense what? That means act of deducting or subtracting something. The same example, let me say, if the person is presented with cough, how you are going to say the person is suffering from respiratory disease only? What are the criteria to say the person is suffering from cardiovascular disease? How we are going to determine the person is suffering from alimentary canal disease? There are certain the other associated features, or there are certain other the points related to history that is going to help you in determining the exact cause of that particular search. Whether is it due to this particular cough is due to respiratory disease, or whether is cough disease due to cardiac disease, or whether the cough is due to alimentary canal disease. So in this way, whenever if you think about the hypothetical deductive model, it is actually involving 7-step process. First step is identify the broad problem area. Suppose if the person is presented with cough, we have to know about what are these different possible causative factors, broad problem area. So let us take one more example, chest pain. Chest pain may be possible because of respiratory disease. It may be possible because of cardiac disease. It may be possible because of alimentary canal disease. It may be possible because of musculoskeletal disease. It may be possible because of a neurological disease. So we have to know about the broad problem area. Chest pain may be due to what are the different possible causative factors. Define the problem statement. That means the person is presented with cough. The person is presented with chest pain. The person is presented with abdominal pain. The person is presented with pain in the knee joint. The person is presented with multiple joint pain. The person is presented with the headache in the frontal area. The person is having the vision disturbances. The person is having the pain on the either temporal region. In that way, define the problem statement. Develop the hypothesis. In the sense, cough is due to respiratory disease, or cough is due to cardiac disease, cough is due to alimentary canal disease. This is what we can say, the developing the hypothesis. Again, when you think about the research aspect, two are there, null hypothesis and alternative hypothesis. The person is not suffering from respiratory disease. That is what we can say null hypothesis. The person is suffering from respiratory disease. This is what we can say the alternative hypothesis. That means developing the hypothesis in the sense we are going to say that the person is suffering from respiratory disease if he is presented with cough. Determine the measures. That means how we are going to say the person is suffering from respiratory disease only. There are, when you think about the steps in the diagnosis, it contains 5 steps: history, physical examination, careful collection of all the data pertaining to the particular presenting complaint. That is what is considered to be the fifth step as such. That means data collection. So that means determine the measures in the sense we are going to do the history as well as physical examination. So by looking into the, we are going to see the person's nose, and we are going to see the person's larynx, and we are going to do the chest examination, that is the inspection, palpation, percussion, and auscultation. After that, we are going to write the different the data. After that, we are going to say that the data analysis as such. That means person is presented with the difficulty in expiration. This is the data, and we are going to see that the person is suffering from the expiratory wheezing. So that means that is with these two data are sufficient to say that the person is suffering from lower respiratory tract disease. Suppose if the person is having sneezing, person is having the pain in the ears. On examination, we are going to see the crust. That is inspection, we are going to see the crust in the nasal mucosa. These are the two data that help us in identifying the upper respiratory tract involvement. This is how the data analysis can be helpful in interpreting the data. That is, the person is suffering from either upper respiratory disease or a person is suffering from lower respiratory disease as such, by looking into the presenting complaint as well as the physical examination. This is what is considered to be the flowchart of a hypothetical deductive model. So that means initially we are going to interact with the patient or interrogate with the patient regarding his presenting complaints. After that, we are going to do certain background research. So that means this is the, we are going to say, whenever if you are seeing the person or patient fresh. So that means if a person is having the experience, this particular background research will be eliminated. We can straight away do the construction of the hypothesis as such. After that, we are going to analyze the results. Thereby, if the based on that, if the hypothesis is true, then we are going to report the result. If the hypothesis is false, then again we are going to do the reconstruction of hypothesis and again analyze the results, and then the rest of the procedures continue. So that means whenever if you say about the examples, so this based on that, let us see the different examples. So that means let us say the first example, that is chest pain. When I think about the chest pain, as such we have discussed at the beginning, 5 main systems that may be afflicted if a person is presented with chest pain: respiratory disease, cardiac disease, alimentary canal disease, musculoskeletal disease, and neurological disease. So ask a question in such a way that, so we are going to come to a possible causes of a chest pain. After that, we have to do the background research. So that means we have to see the textbook in relation to the chest pain, approach to the chest pain, and based on that, we are going to again ask the question to the patient where the chest pain is, whether is it in the retrosternal region or whether is it in the on the either sides of the chest, or whether is it having the relation with the food intake, or whether it is having the relation with the, what do you say, that the movement of the chest as such, or otherwise is there any specific dermatome affliction in the chest region. So these are the different associated presenting complaints we are going to interrogate with the patient. Thereby, this is what we can say, the doing the background research. After that, so we are going to construct the hypothesis. So the person is having the chest pain. The person is having chest pain on either sides of the chest. Person is having the cough and he is having breathlessness specifically during the expiration. All they are suggestive of the construction of the hypothesis may be leading to the person is suffering from respiratory disease. Suppose if the person is having the chest pain and retrosternal region and it is radiating towards the left shoulder, worsening of the pain on climbing the stairs or while doing the exercise as such, getting relieved by taking rest within minutes, within 2 or 3 minutes, the person is having the reduction in the chest pain. Construction of the hypothesis will be towards cardiac disease. And after that, so that is the next is the aspect. The person is having the chest pain and the worsening of the chest pain happens on consumption of the food and it is associated with burning sensation in the epigastric region, sore erectations as such. So here construction of hypothesis will be the person may be suffering from alimentary canal disease. After that, so the fourth step will be analyzing the results and drawing conclusion. So that means, so if the person is having the chest pain and retrosternal region, if the person is having the pain on the radiating towards the left shoulder, development of the chest pain is acute one, having the crepitations on the bilateral, what do you say that the basal areas, bilateral basal crepitations on either sides of the lung. So this is what we can say. If you analyze these presenting complaints plus the physical signs, we are going to say that the person is suffering from the pulmonary edema. So this is how we are going to say that the person may be having the chest pain may be due to cardiac cause. So like that, if you think about the abdominal pain, so this is the second complaint as such where we can able to make the diagnosis based on the hypothetical deductive model. When you think about the abdominal pain, so there are 9 regions of the abdomen are being mentioned. So first of all, if we have to know about exactly what about the onset, whether is it sudden, gradual or insidious. This is the first and foremost aspect as far as the history of present illness are concerned. After that, the duration of the presenting complaint. So that we after how many days the person is having the uh, presenting complaint. So that means you are going to interrogate with the patient and then you are going to do the background research one by one in a cycles. If you are having the any kind of the lacunae, then you are going to again ask a question with the patient and after that we are going to do the background research again and again. After that we are going to make the construction of hypothesis. So that means if the person is having the abdominal pain in the epigastric region and if it is having the burning sensation, that means if he is having the sore erectations, etc. And if the person is unable to lie down, person is having the sore erectations, burning sensation, even that happens even up to the throat region. So that is specifically indicative of a construction of the hypothesis maybe towards the alimentary canal dysfunction. That too, upper alimentary canal dysfunction. That too, the what do you say that hyperacidity syndrome. So that means where there is excessive secretion of hydrochloric acid will be present. So based on that, we are going to analyze the results. That means by doing the physical examination as such. So that is the per abdominal examination we are going to do. After that, we are going to do the analyzing the results and then we are going to come to a conclusion. The person may be suffering from the alimentary canal dysfunction, upper alimentary canal dysfunction or hyperacidity syndrome. In the same way, we are going to convey the same to the patients, which will be helpful in making the diagnosis as well as differential diagnosis. Take-home messages from today's discussion. Hypothetical deductive model is actually helpful in narrowing the diagnosis to one particular system as such. So that means what are the steps we are going to do in this particular hypothetical deductive model? So that is, we are going to do the interrogation with the patient and doing the background research. So this particular two steps, they occur repeatedly. So that means if you are having any kind of the lacunae, then again, we are going to do the background research. So that means by reading a textbook or by reading the physical examination or physical methods textbooks as such. And then we are going to interact with the patient again. Then we are going to do this. And then after that, we are going to make the hypothesis the person may be suffering from this particular systemic illness. And after that, we are going to do the testing the hypothesis by doing the physical examination. Plus, by doing the examination, we are going to again confirm the hypothesis, or we are going to reconfirm the hypothesis. After that, we are going to do the laboratory investigations to confirm that particular hypothesis testing again. After that, we are going to analyze the results and drawing the conclusions. And later, we are going to report to the patient regarding the diagnosis as such. Dear ANA community, that's all for today. This is the first model, how we are going to make the differential diagnosis of the individual as well as diagnosis of individual. Suppose when you think about the Ayurveda aspect, whenever a person is having the the Rajaha Sevana, we are going to say that the person may be suffering from Pranavaha Srotodushti. And when you think about the Pranavaha Srotodushti, as per the application, we are going to say that there may be a possibility of affliction of either respiratory disease or respiratory system, or otherwise there may be a possibility of affliction of alimentary canal dysfunction. So that means there may be a possibility of entry of this rajas or the dust as such that may happen more commonly in the respiratory system, and to a lesser extent that may enter into the alimentary canal. So identifying which particular area this particular rajas is entering, so that is the helpfulness of the Sapeksha Nidana and Vyavacchedaka Nidana. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners, or true Nidana learners, or true Ayurveda diagnostic learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.